our old way of life? Obviously, the short answer right now is we don't know for sure. We are continuously monitoring the data that comes in with regards of trying to develop a goal of lifting or easing back those restrictions as quickly as we can. And I think you're going to hear more about that this afternoon. We know people have lost jobs and businesses are closed or are struggling. We know the pain is real. But when the stay-at-home order will be lifted will be determined by the state, and it will be based on these 6 indicators. Number 1, the ability to monitor and protect our communities through testing, contact tracing, isolating and supporting those who are positive or exposed. 2, the ability to prevent infection in people who are at risk for more severe COVID-19. 3rd, the ability of hospitals and health systems to handle surges. 4th, the ability to develop therapeutics to meet the demand. 5th, the ability for businesses, schools, and child care facilities to support physical distancing. And number 6, the ability to determine when to reinstitute certain measures, such as the stay-at-home orders, if that becomes necessary. However, we have begun the necessary and, let me tell you, it's complex discussions about reopening sectors of our civic life. Internally, we've talked about when we'll be able to reopen county public facilities, including our parks. And just an hour ago, I was on a call with Mayor Faulkner and I, who are chairing the First Recover Advisory Group, which we formed last Friday. This is a regional group with representation from businesses, from chambers of commerce and organized labor, and this group will hold regular meetings looking at how businesses can reopen safely while adhering to public health orders and prohibiting mass gatherings and maintaining social distancing. We've asked a lot of San Diego over the last few weeks, and many of you have come through. We thank you sincerely for that. Now we're asking you to stay just a little bit longer for a short period of time until we get over this hump and we know that we've got the worst of this disease behind us. I don't know who came up with this phrase, but I saw it online over the weekend, and I think it's somewhat appropriate. It says, better 6 feet apart than 6 feet under. Now let's continue with today's briefing. We're going to hear first from Dr. Wooten on a medical update, and then second we'll hear from Supervisor Fletcher on an update on our informational charts. Dr. Wooten?
Good afternoon, everyone, and thank you, Supervisor. As we decide on what non-pharmaceutical interventions that we will dial back on, our decisions must be based on objective and data-driven information, and not what we feel or think. And just as Supervisor Cox has stated, the 6 indicators are from the federal government, and that 6th indicator is the ability to determine when to reinstate certain measures, such as the stay-at-home orders, as well as others. And we will be following the President's Opening Up America guidelines, where there are 5 gating criteria that must be satisfied before proceeding to a phased opening. These criteria are in the areas of symptoms, cases, and hospitals, and I would like to share 2 of those metrics with you here today. The first metric is related to cases. We want to see a downward trajectory of positive tests as a percent of the total of the total tests within a 14-day period of time. And as you see here on this slide, from April 6th through April 19th, you see a marked decrease in the trajectory, the overall trajectory, as demonstrated by the orange line. This is indeed encouraging, and I hope you feel that way as well. The second metric is related to hospitals, and here we want to see a downward trajectory of hospital cases over the past 14 days. And again, we've used a time period of April 6th through April 19th. And here we also see a clear downward trend. We will continue to monitor these metrics as well as other metrics, and we will share with the public and our Board of Supervisors tomorrow to paint the broad picture of what needs to happen before we can dial down to open up San Diego. And we will continue, again, to monitor all of these metrics and other metrics to answer the question about dialing down various health officers' orders and recommendations. With that, I'd like to proceed to providing our daily update on various statistics. Globally, we've had over 2.4 million positive cases, which includes 167,592 deaths. Nationwide, there's been 766,212 positive cases, including almost 41,000 deaths. Statewide, there have been 31,675 positive cases, which includes almost 1,200 deaths. And today, the County of San Diego is reporting 2,325 cases, which is 57 more than yesterday, as well as 72 deaths, which is one more than reported yesterday. Of the additional deaths, this includes a female in her mid-80s. And the individual also did have underlying medical conditions. Of the total number of cases that are reported, I think our trends continue with about 50% being between the ages of 20 to 49 years of age. There's also an approximately 50% split between male and females. And of the 562 hospitalizations, which is 24% of the total number, 189 of those, which is about 34% of the total number of cases hospitalized, were admitted to the ICU. And lastly, regarding the 72 deaths, this represents 3% of the total number, and for these deaths, 46% were female, 54% male. And regarding race and ethnicity, 41 or 59% are white, 21 or 30% are Latino or Hispanic, 6 or 8.6% are Asian, 1 or 1.4% is Pacific Islander, and 1 or less than 2% is of multiple races. To date, none of the individuals for which we have race and ethnicity have been identified as being Black or American Indian. And 2 of the 72 deaths had no known race and ethnicity. So that category or group has improved since our last report. And our sincerest sympathies and condolences, again, go out to those families and friends who have been impacted by COVID-19. As a reminder, please check the website for all of this updated information. And regarding outbreaks in congregate and community settings, today we are reporting a cumulative total of 33, which includes 24 outbreaks in congregate facilities representing 358 cases and 41 deaths. And there is 1 new outbreak in this group since yesterday. And we have one of the congregate care facilities that is now inactive. Also, we have 9 outbreaks in community settings representing 56 cases and 2 deaths, and there have been no changes over the past several days in that particular category. And again, I would like to commend the public for staying the course, and we want you to stay the course until the end of this month so that we can continue to see a decrease in the spread of COVID-19, and we can have enough evidence to justify dialing down and loosening up some of the public health officer orders and recommendations. Now, please welcome back to the podium Supervisor Cox. Sorry. Now, please welcome to the podium Supervisor Fletcher.
Thank you, Dr. Wooten, and good afternoon. Supervisor Cox walked through some of the state guidance about what needs to be considered when it comes to reopening, and Dr. Wooten alluded to some of the federal guidance about things that should be considered in reopening. along with Dr. Wooten walking us through some of the metrics that we're most closely monitoring in terms of telling us at what position we're ready to start coming out, that being percentage of tests daily that are positive, along with new hospitalizations. And so we will continue to monitor those metrics, along with refining our approach to let us know when we can come out and when we may have to go back in. But through all of this, what we know in San Diego County is we know that we made the right call early in beginning our actions in response to this pandemic, and we know that those early actions have put us in a strong position. We asked people to stay at home, to wear a mask when they leave their home, to practice physical distancing. We put in a number of restrictions and guidance, and that has put San Diego County in a strong position. We also know that this has been hard. It has taken a heavy toll on our economy, our employers, our employees, our mental and physical health, and the social bonds that hold our community together. It's impacted each and every one of us. But we also know that if we don't come out of this situation with the same care and caution, with the same adherence to public health, the available data, the expert advice we get from the medical community, the information that guided us into this situation, if we don't adhere to that same source of decision-making and caution when we come out, we could easily throw away all of the progress and all of the sacrifices that have been made today. There are some out there who are calling for an immediate return to normal right now because our cases are low. But to paraphrase an analogy from a Supreme Court justice, that would be like throwing away your umbrella in the middle of a rainstorm because you haven't been getting wet. The reason we see progress to date is because of the actions we've taken, because of our focus in particular on the month of April, and we must be very careful and very deliberate that as we come out of our current posture, we do it at the right time, with the right planning, and with the right focus. It would do us no good as a region to come out irresponsibly in a way that could set us in a horrific situation as it relates to the integrity of our healthcare system. We have to see this through. There can be no economic recovery without the right planning, testing capacity, and health system efforts to ensure that as we begin to ease, we can do it in a responsible way, in a consistent way, in a way that's in the best interest of our region. So as we prepare to come out of this, it's important that we come out of it in the right way. And that means that over the next coming days, we all have some work to do. I'm going to outline for you briefly some steps that we at the county need to do to be ready and prepared for the easing of conditions, what our local jurisdictions need to do to prepare for an opening of beaches, parks, and open spaces, some things our business community need to do to prepare for an expansion of essential services when the state outlines that as ready, things that we're going to do in partnership with our healthcare system, and perhaps most importantly, what each and every San Diegan needs to do over the coming days and weeks to ensure our metrics to turn the dial remain in the right place and to give us that option and to also prepare for what we will call a new normal. So let me start with the County of San Diego, the things that we need to do over the last 2 months of April. It starts with continuing to develop our plan for testing, tracing, and isolation. We still don't have enough testing capacity to determine how many people are sick, to track every single person that they've come in contact with, or to require isolation of anyone who's tested positive. As we begin to come out of this, it is important that we have that capacity, and we are working daily to get in place what we will need in order to accomplish that, and that remains a high focus and priority of county government. The second is we need to further develop clear metrics for moving the dial. As we begin to anticipate loosening, we need to identify what those exactly are and the timeframes for them, along with clear metrics of if things begin to head in the wrong direction, what we need to know that tells us that we need to move in the opposite direction. We have taken action daily to be transparent and straightforward with what we know and what we don't know, and we want to continue to refine our metrics and models so that we have a real clear insight on what is going to drive continued decision making. And we have to develop a phasing of when we can relax essential business, mass gatherings, and other things to suggest to the state. To be clear, the essential business listing is a statewide order, and any changes to what is an essential business will have to be worked out with the approval and coordination of state government. Those represent a couple key things the County of San Diego has to focus on for the remainder of April. As it relates to parks, beaches, and trails, we need cities and local jurisdictions to start planning on how they can reopen these institutions for active use so people can safely get outside. Now, to be clear, our public health orders from the county provided some restrictions on parks and trails. But under those current restrictions, parks and beaches are allowed to be open today if they meet the requirements of the public health orders. The requirements that we have outlined are four. One, we have closed parking lots at all beaches, parks, recreational facilities, and this was done in an effort to limit overcrowding and to limit travel from one region to another. We prohibited group activities, like a basketball game in a park, playing football, doing yoga. We said you could walk or move through a park, but not stop and have an activity. We closed down play structures and recreational centers, jungle gyms, slides, swings. This was to protect kids from picking up viruses from the contact surfaces at these structures. And we said that cities should close their parks if they cannot ensure physical distancing. Some jurisdictions chose to close them completely. Some, like the County of San Diego, chose to close some and keep others open. But cities retain the ability to be more restrictive than the county public health orders, but not less restrictive. Now, as we move forward, we are ready to begin considering easing the restrictions the public health orders have in place countywide. In the coming days, we're going to release guidance to local jurisdictions around the parameters for them to draft park-specific plans that they would put them in a position to accompany the implementation of those plans, along with further easing of the county's public health orders, again related to those four items surrounding parks. These plans that the local jurisdictions are going to be directed to develop will, one, need to be posted at the site of the park and submitted to the county. They will need to limit gatherings to no more than household units in close proximity to one another. They will include facial coverings as practical, sanitation and hygiene procedures, a plan to ensure physical distancing, restricting parking to half capacity in an effort to lower the total occupancy of the parks. If bathrooms are open, they'll need to have cleaning protocols. They'll need to have on-site staff for security to ensure that the restrictions are being met, somebody on hand at each of these locations to monitor and track compliance. Play equipment will remain closed, recreation centers will remain closed, and while there will be no organized team practice, individuals in a household unit may participate in activities together with individuals from that household unit, and they must have enforcement plans worked out with local law enforcement. Our hope is to lift the restrictions on passive recreation, parking lots, and water sports in the coming weeks. But again, pursuant to what Dr. Wooten said, we need to see continued progress on the numbers that we are getting daily, and we need to work with our jurisdictions as they develop plans to ensure that we can protect public health in these outdoor recreation centers. Separate considerations when drafting individual park plans, or jurisdictions might consider separate hours exclusively for vulnerable populations or seniors, separate hours for joggers so there aren't running by walkers, directional trails going in single directions, limiting hours, and other things that will be at their discretion. So again, to be clear, the county public health order restricts parks and beaches in four key areas. We are going to work with our local jurisdictions as they develop plans. We're going to continue to monitor the public health situation, and the aim would be to lessen or lower those county-wide restrictions to allow for greater access to our parks. When it comes to beaches, we know that there's been a lot of interest and concern around our beaches. Our public health order did prohibit swimming, surfing, paddleboarding, boating, and other recreational activities on the water and beaches, and we are working with our coastal mayors and cities. They have asked us to implement a regional approach so that the guidance surrounding re-entering the ocean in particular is consistent across jurisdiction. We had a meeting earlier with the mayor of San Diego. We've had conversations with other mayors, and today they were convening as a group to come up with a phasing plan that they would like us to consider, that would reinstitute access to the water, but would do it in a phased approach that they believe would be easiest to implement and easiest to enforce. And we look forward to hearing back from the coastal mayors with their recommendations and suggestions, and we look forward to working with them to implement access back to the water when the plans have been developed and when it is appropriate per our public health guidance and direction. Next group we want to work with over the next 2 weeks is our business community. We need businesses to begin planning now for how they will reopen and what they will do to ensure that their employees and their customers are protected. Many are already doing this. I've spoken to a number of business leaders, and they're working hard to reimagine or rethink how they would operate in light of the ongoing threat presented to us from COVID-19. We are encouraging businesses to reimagine, to redraw, to revisit what they do in order to achieve these aims. And I want to reiterate that the specifics of additional businesses being opened, that authority currently resides with the state of California. We expect that everyone would begin planning so that we could move quickly if the state were to allow it and if the conditions on the ground here warranted it. But we are asking businesses to have in their plans things that maximize telecommuting and telework, having in place physical distancing and face covering plans for employees and customers, looking into the possibility of temperature checks or health screenings upon entry for employees and possibly guests, having sanitation and hygiene protocols, designated someone on their staff as a health and safety manager to oversee public health ordinances and compliance and ensure uniform enforcement and compliance with the plan that's been listed. Again, the list of essential businesses are set by the state, and we're still waiting for additional guidance on what it could look like. But while we wait for that guidance, we should plan as a region for what that loosening would look like. As it relates to hospitals, tonight we have a call with all of the CEOs of our hospital systems, and we look forward to their continued input and guidance regarding both the status of their personal protective equipment, but also their thoughts and insights on opening up elective procedures into their facilities. And when we get more guidance and feedback from them, socialize that with our public health staff, we will have a greater sense of how we can move forward. So we've outlined what the county needs to do over the next 2 weeks, what we need to do with local jurisdictions as it relates to beaches, bays, and trails, what we'd like our business community to do, and finally, it is what we need the public to do. In order to be able to come out of this, we must not only continue the progress we've made, but we must recommit ourselves to it. We have consistently said that the month of April is the most critical month for San Diego County, and we still have 2 weeks to go in April. And so we are asking the public in this week and next week that we continue to all do our part to ensure that the positive information we've been provided, to ensure that the positive direction we're headed is not reversed. This means we need you to stay at home. If you leave for an essential job or you leave for an essential service, ensure a face covering. Please adhere to the orders, and we have to all accept that even though we are beginning to discuss what it will look like when we come out of this, we are not there today. We have to see continued progress, and we also have to accept that we're talking about a new normal. Until such time as there is a vaccine or a widely available drug treatment for coronavirus and COVID-19, we are likely to continue to see limitations on mass gatherings and limitations on our daily life. Our routine way of life will include physical distancing, face coverings, limitations on gatherings, and we need to all be prepared for a situation where, based on the metrics of that dial, if the numbers and cases begin to increase too rapidly or too severely and it threatens the integrity of our healthcare system, we could be in a position of dialing back. But in order to put ourselves in the strongest position, we need everyone to continue to work with us, to continue to hold fast, as difficult as it may be, to continue to be patient in very uncertain times, and to know that we will come out of this. But just as we took great caution to protect the public and put our county in the strongest position going into this, we have to exercise that same caution. We have to exercise that same patience. We have to exercise that same commitment as we contemplate coming out of it. With that, I would like to jump into our charts for our daily updates and reports. Before I go to the first chart, I want to give an update on the testing at the convention center. To date, there have been 116 total tests administered to unsheltered individuals and the support staff at the convention center. 113 have come back negative. 3 of them were inconclusive and will be retested. So to date, we have not had a single positive case out of the convention center. So 116 total, 113 negative. 3 of them were inconclusive and will be redone. We'll go to our charts. Today, we are reporting for today 57 new positive cases, takes us to 2,325. Total testing, you can see today there, 1,310, takes us just short of 34,000 total tests. The next chart is the comparison of total tests versus positives. We'll begin breaking this out on a daily basis so you can see the percentage each day in terms of what that looks like and not just the total percentage. The next chart, our everything chart, has the positives, the estimated recoveries, hospitalizations, ICUs, and loss of life. And there you can see the doubling rate in parentheses for positives. We are currently on our 5-day exponential growth rolling average at 26, doubling every 26 days, hospitalizations at 27, ICUs at 56, and loss of life at 25. Very little change in our motel room updates. We will continue to make available what is needed to address both of those needed. Outreach efforts continue. 211 calls are up, nurse calls are up, epi calls are up, hygiene kits are up. Hand washing stations and toilet distributed remain flat and should be expected to remain relatively flat pending additional requests. Personal protective equipment, an increase in every single category that you see across there. Now more than 2.2 million individual items of personal protective equipment have been distributed. Ventilator numbers down just a bit because only 21 of 23 hospitals reported when we pulled this chart. We do see a slight increase in the number ready to deploy from the county. These represent those coming back from being serviced, and we will continue to update you on all of those. Thank you.
Thank you, Supervisor. We'll go straight to the questions. We have 3 questions on the call line. Again, if you're not introduced by your outlet and your name, when you're called up, please do so. First question.
KPBS, please state your name and question.
Hi, my name is Matt Hoffman calling from KPBS. Over the weekend, there were rallies held in opposition to coronavirus restrictions. Are you concerned about people protesting the stay-at-home order and not following your health orders as it relates to gatherings and social distancing?
I think Dr. Wooten's going to answer that question.
Yes, of course. We are definitely concerned about that. As everyone could see over the weekend, people were not adhering to the social distancing strategies, 6 feet between individuals if they were not family members, and most individuals were not wearing any type of facial covering. So we will see if we see any change in the number of cases over the next couple of weeks. Again, as you know, the incubation period is 14 days, so we will be monitoring that closely as well. Thank you.
And then just to follow up on something you guys were talking about, mentioning easing restrictions on recreational activities like surfing and boating, stuff that Supervisor Kristen Gaspar and Coronado Mayor Richard Bailey are calling for. You said that ease would happen over the coming weeks once cities submit plans for enforcement. Does that mean if cities like Coronado submit a plan first, that they could have surfers in the water before other cities, or how does that kind of work?
No, we are asking municipalities to plan for at the end of the month because we've been asking everyone to adhere to staying at home and also meeting the 30-day challenge. So at the end of April, that's when we want to have plans that we can implement and execute. So we don't want to wait until that point in time to start planning. And Supervisor Fletcher probably has additional comments as well.
Thank you. Matt, it's important to think about beaches and trails in one category. So right now, jurisdictions can have those open if they choose. The county has limitations and restrictions on them, but a park or a trail or even the non-water part of a beach, a jurisdiction could have open today with the restrictions we have. We're asking them to submit plans for parks and trails about how they would operate in an environment where we would lessen or remove the restrictions that we have in place. When it comes to beach and water sports and activities, we have not all of the mayors are in agreement. Some of them would like us to move more aggressively. Some of them would like us to exercise more caution. But one universal thread that we've heard consistently across mayors is they would like a regional standard. They would like all of the jurisdictions to generally adhere to one set of requirements. And so the mayors are meeting together, and they're going to see if, as a group, they can come to some consensus about a phasing in of water sports at our beaches. They have concerns about overcrowding. They have concerns about things like we've seen in Florida and other places. And so we are relying on our coastal mayors to work together to make some recommendations to us on a phasing plan whereby we could lift the restrictions on swimming, surfing, paddleboarding, kayaking, and recreational boating. And so we're going to work with them to develop those plans. We're going to do those, obviously, in coordination with our public health officer. And at such time that we think we have a phased-in plan for water sports consistent with the general consensus of our mayors and consistent with the general approval of our public health officers, then we would be able to implement those.
Appreciate your time.
Next question.
NBC 7, please state your name and question.
Hi, yes. This is Gabby Rodriguez with NBC7. I have a two-part question. First, I know that we have all been kind of concerned in watching the protest, as was mentioned already, and the fact that many people weren't wearing face coverings. So is there a plan in place as far as for contact tracing to try to see if the protests themselves equate to more positive cases in the coming weeks?
Dr. Wooten?
I think on the last question, we will continue to monitor in our surveillance system and just monitor the cases that are reported. Can you hear me? Yeah,
Yes, I'm sorry.
we will continue to monitor the cases that are reported. You know, it will probably be very difficult to trace cases back to individuals that were protesting, but that is certainly something that we can look at in terms of additional questions that we could potentially ask. But again, will be on heightened surveillance and looking at if that incident over the weekend, if we see an increase in the number of cases. So we will just have to monitor that over the next 2 weeks and see what occurs as a result of our enhanced monitoring.
Thank you.
Okay, next question.
Union Tribune, please state your name and question.
Hi, it's Gary Worth from the Union Tribune. I had a question about active cases. I don't know if we've heard on any one day how many active cases there are, and how would you calculate that? Would it be adding up the number of new cases over 14 days and subtracting deaths? And is there any trend if you have a number on that, or are they trending down as far as being active cases?
Okay, Dr. McDonald's going to answer that question.
Yeah, thank you for that question. The statistics that we put on recovered patients are just an estimate of the number of patients who are recovered, and we certainly know the numbers of individuals who are actually hospitalized. We do follow that on a day-to-day basis. Those numbers are in fact reported to the state on a daily basis, and we do know what the trends are locally for hospitalized patients, but that's only 1 out of 5 of the patients who would still be active. There would still be a fair number of individuals who would be at home. We would learn about them when they were reported, and we don't follow them on a daily basis. We anticipate most of them would improve over the course of 7 days, and that is how we get that estimate of people who are recovered versus still ill. So I can tell you that as far as trends are concerned, we have noticed a trend in the last couple of weeks that the hospitals in the southern part of the county have a tendency to have a higher census for COVID as patients who are both in the hospital and then in their intensive care units. We also know that the number of individuals that they are testing have a higher positivity rate in the hospitals that are in the southern part of the county. So that is the most recent trend that I can refer to, but it is hard to know exactly what the dynamics are of the individuals who are maintaining themselves at home, which is really the majority.
Okay, thanks.
Okay, we'll go to our first texted question.
This question is from Ken Stone with the Times of San Diego. Please ask Mr. Fletcher if he supports Sheriff Gore's decision not to cite Encinitas protesters Sunday and whether he will offer new guidelines for public protests as suggested by Reverend Shane Harris.
I think what we're going to do is refer that question, or refer your question to the sheriff and let him respond to it. That's the appropriate party to respond. Next question.
This is quite a long question from Cheryl Clark regarding nursing homes. How many of San Diego County's COVID-19 patients reside or have resided in San Diego County nursing homes, and how many clusters have you counted in nursing homes? I'll stop there.
Okay, Dr. Wooten's going to respond to that.
So thank you, Cheryl, for that question. First of all, we are utilizing the term long-term care facilities. So that includes skilled nursing facilities. It includes long-term care nursing facilities. We report out, and as I reported today, we use the term congregate facilities, and that includes long-term care and skilled nursing facilities as well as other groups. And we have, actually, if we can show, actually, we don't have a slide for that, but I think we had over 330 individuals that were positive, and I have the numbers being brought to me now. Yes.
58, and there's 19.
So we have, as I stated earlier, 358 positive cases are in congregate living facilities, and then we have community settings, which are not congregate living facilities, that includes 56 cases. So that's the way we report the data. And what was the second part of the question?
How many clusters have you counted in nursing homes?
Again, that's the information I gave earlier. We have in congregate care facilities, of the 24, 19 are in nursing homes or skilled nursing facilities.
Also regarding the names of the nursing homes, you've refused to say which nursing homes to date that these occurrences are happening, but after the Trump administration's order on nursing home transparency Sunday night, will you now be releasing the names of those nursing homes?
Well, actually, all of the congregate care facilities or skilled nursing facilities report to the state, so the state is now publishing that information, and it is on their website.
Okay. A follow-up question about the public health impact of disclosing the names of nursing homes. Since nursing homes may not be testing all of their residents every day, it may mean that some family members could feel compelled to bring their loved ones home, not knowing if they are infected. If they are, that could result in household members getting infected. If family members do decide to take their family members out of nursing homes, what do you advise? These could be people who are not sick with COVID-19 and so they're not showing symptoms, so they may infect other family members.
So last week at our congregate facility sector meeting, I discussed with all of the attendees or participants, we are willing to go out and test nursing home staff as well as residents. And we are beginning to do that. So that is part of our expanding our testing capacity so that we are more aware, particularly in the long-term care facility, because that's where a large number of our cases have been seen, both in residents and staff. So we are beginning to do that.
All right. Thank you, Dr. Wooten.
Okay, we'll go to the next question.
Yes, this is from Lisa Halverstadt, Voice of San Diego. As homeless San Diegans move out of county motel rooms for individuals who need to isolate or leave local hospitals, many are in need of continued shelter and support. Are these individuals being directed to other resources, and if so, how? What are hospitals being advised to do at this time when discharging a homeless individual? And has there been any recent progress when it comes to bolstering step-down and respite care opportunities for the homeless patients?
Supervisor Fletcher is going to respond to that question.
I can revisit any of those for you.
I got it. So basically the way it works is if an unsheltered individual is COVID positive and they are in our hospital system, then when they're ready to be discharged from the hospital, we make available the public health motel room, which comes with all the services and support associated with that. And then when they're ready to be discharged from there, we have an MOU with the convention center where they can be transported directly to the convention center. If somebody never goes to the hospital and they start at the public health motel room, then again, when they clear the criteria that they are through their COVID-19 exposure, then they would be transferred to the convention center. As it relates to building up capacity outside of the current system, in large part, the challenges that remain are the challenges that remain with the unsheltered prior to dealing with COVID-19. and that there is a shortage of respite care, there is a shortage of step-down care. There are a number of efforts underway to try and increase that, which are continuations of efforts that were underway previously. And then there's some new efforts that are being expedited. Behavioral Health Impact Fund is one that is designed to bring on more residential level treatment and other things. Housing Commission is working on things. Everyone's trying to look at what they may be able to do to increase that supply and capacity. But as it relates to COVID positive unsheltered individuals, whether it be a hospital, a public health motel room, or the convention center, there are opportunities for them to get the appropriate care at the right time based on their exposure.
Thank you, Supervisor Fletcher. I'm going to have you stay up there and answer a question from Jay Posner of the UT. Golf courses in some California counties, such as Ventura and Orange, have been opened with restrictions, and Riverside is considering doing the same this week. Has there been any consideration to allowing some or all of the golf courses here to open with restrictions, of course?
Jay, I appreciate you asking that, because that was actually in my notes to mention at the beginning, and I skipped over it. So we talked about what we're doing with beaches, where we're working with mayors to come up with a plan for how we may ease those. We're simultaneously working on plans for outdoor recreation that isn't necessarily tied to a jurisdiction. So that would include golf courses, perhaps tennis facilities, equestrian, other types of things that may not be run by a city or a park entity. And so we are working with those entities to come up with a plan for how we could reopen those. We're looking to a lot of the jurisdictions that are a little bit ahead of us in terms of what they've done and what some of their best practices are, along with applying some common sense things you would do to limit exposure, to limit transmission. And so we expect the opportunity to open and increase those types of facilities, whether they be golf or other outdoor types of things, to progress at about the same rate and timeline as our efforts around park and water sports. So yes, we are working specifically on those, and we will keep you posted on the progress.
Thank you, Supervisor Fletcher.
Okay, let's go to the next question.
Yes, this is from Claudia with Univision. How will the extension to keep the border closed for another 30 days help lower the curve in San Diego County? Since a large number of cases of COVID-19 are in South County, is there a correlation between the rising numbers in Tijuana?
I think both Dr. Wooten and Dr. McDonald are going to respond to that question.
The question states another 30 days. I don't think we've stated that I know that the federal government has closed the border with the exception of essential workers, because there are individuals that live in Mexico, work here, and vice versa, or people that might work here and have their insurance provider across the border. But in terms of just, that's what's in place right now. Only essential workers and individuals that are U.S. citizens or permanent legal residents, they have the right to come back and forward across the border. There has been a lot of activity going on in the past several days in terms of meeting and looking at what that impact is to our South Bay region. But I'd just like to remind people that the Chula Vista area is the second largest city in San Diego. And in addition, they do have the second largest number of cases. And with that, the Southern Bay area is a densely populated area. So it may not be that undifferent, and we are looking at that too. During regular flu season, do we see the same type of patterns of admissions and hospitalization and ICU use? So we will be looking at that for a comparison. And Dr. McDonald also wants to make a comment.
Yes, I think it's fair to say that our neighbors to the south in Tijuana and actually all across northern Baja California are seeing many more cases of COVID. I think there are multiple reports, both from the Mexican public health authorities and also coming from the hospitals themselves, that there is increasing activity in that part of Mexico. It makes sense that we may have some increased activity related to that on our side of the border. There are a lot of family ties and work ties and essential work ties for individuals who live close to the border and work on the other side, and that actually goes both ways. So we're looking at that very closely. Remember, the statistics that we produce and show on our daily updates are for San Diego County residents. And we do also get reports on cases who are non-residents. They may be non-residents from northern Baja California. They may be non-residents, frankly, from all over the country. So we will provide an update on the number of non-residents who have been detected with COVID later on this week. But I do think that some of the increased activity that is in northern Baja California is impacting the southern part of the county, and we're watching that again very carefully.
Donald.
Okay, let's go to the next question.
This is from Gustavo Solis from the San Diego Union Tribune. Supervisor Cox, the mayor of Coronado recently wrote an op-ed calling the county's health orders an abuse of power that threatens to erode the public's trust and compliance. What is your response to Mayor Richard Bailey's comments, as well as the hundreds of people who protested against the orders over the weekend in downtown San Diego and Encinitas?
Well, Mayor Bailey is a good friend of mine. He's a good mayor for the city of Coronado, but I guess I disagree with him to a point. You know, we asked the citizens of San Diego County to give us 30 days, starting April 1st. That 30 days is going to be up in 10 more days. We're seeing some very positive things in regards to the decline in the number of cases and the hospitalizations. That's a good sign, but we need to have about 2 weeks of declines, which actually the high point was on April 14th. So we're very close over the next 10 days to achieving that goal, which really gives us, I think, a confidence to start lightening up on a lot of the restrictions that we've had. Now, there may be some opportunities between now and then to begin to dial back some of the restrictions, but the bottom line is, I know at 2 o'clock this afternoon, all 10 mayors of the coastal cities in San Diego County were invited on a phone call. I was not able to be on that call, but I know that it also included representatives from state parks. The worst thing that could happen is having 1 or 2 cities deciding that they're going to take a different approach. Obviously, I think the end result of that would be those beaches would be overwhelmed, and there's no way that social distancing could be maintained. So we're hoping that those 10 mayors, those 10 cities and state parks can all agree on one plan that they can present to us, and we can try to implement over the next few days. And within the next 10 days, we think we could be in a position if these trends continue in the way that they are. So I just ask for the help of the citizens of San Diego to give us the rest of the month of April to get to that point where we have a strong enough assurance that we've got this under control, at least at this point, and responsibly dial back some of those restrictions that we've had to put in place. Next question.
Thank you. These are actually very similar, so I'm going to bunch 2 together. Marilee Moore from Fox 5 and Rachel Bianco from Channel 10. On Saturday, we saw a large crowd of people in downtown San Diego protesting against the stay-at-home orders. Many were not standing 6 feet apart and were knowingly breaking the public health orders on large gatherings. Why was no one cited? We know of other cases where people were cited when they were aware they were breaking public health orders. Why was the decision made not to cite this group of people who are actively violating the orders?
Well, I'm not going to speak for the sheriff or the chief of police for the city of San Diego. I think you'd have to direct those questions to them. But my understanding is that we are respectful of people's rights to protest. We wish people would abide by the public health directives that have been given. They were given strictly for their own personal health and the health of their family and friends and people that they don't even know that they may come in contact with as they're walking down the street or as they're standing next to them with a protest sign. So again, I guess I come back to the point, give us 10 more days. Give us an opportunity to take this month of April to get this disease, this pandemic under control in San Diego County. We're doing better than most counties across the United States, but we're not there yet as far as being able to remove the restrictions that we've had. And again, as I think Supervisor Fletcher has said, Dr. McDonald, Dr. Wooten, it's going to be a dialing back of these restrictions. So we ask for your help and cooperation. We, understand people have the right to protest, but again, we ask for your cooperation and not violating that 6-foot distance, keeping your face covered, and please refrain from gathering in large groups until we get to the end of April.
And this question is from Hunter Sowards from KUSI. Why are our testing protocols so limited? Most experts say testing, tracking, and treatment are the keys to recovery, but we are testing so few. Will we reopen without widespread testing?
Okay, we're going to get again our two medical experts, Dr. Wooten and Dr. McDonald, to respond to that question.
I just want to start out by saying, and I've stated this multiple times before, San Diego County is conducting more testing than any other jurisdiction in the state of California. And we don't make the test kits. We get them from the federal government, the CDC platform, and then Abbott makes the M2000 platform. And we get what's available from the industry. So we have tried to increase our capabilities, and we have increased our capabilities. We have the CDC platform, the Abbott platform, and now we have onboarded the Fusion or Hologic platform, which actually can test in one run 500 tests. And if within a 24 hours, we can do 1,000 if we need to. So we are increasing our capability within the county. We are also working with hospitals, and they are increasing their capabilities. They've done that over the past 2 weeks since our last presentation to our Board of Supervisors. So the local capacity is increasing, and that's, again, why we have formed a laboratory testing task force to work with the various industries, hospitals, federally qualified health centers that are testing, and right now that's the Family Health Centers of San Diego, as well as our commercial laboratories, to number one, increase to the capability that, the known capability that we have, and to look at other areas where we can expand and increase our capabilities. And Dr. McDonald will also like to come to the mic.
Yeah, I think really the question is, why is the testing restricted? The answer is because there's not enough tests right now, and so we're trying to direct it to where we think it is needed the most. The good news is, as Dr. Wooten described, capabilities and capacities are increasing, and we are working with each of the systems and creating new messages to our providers about increasing the number of individuals who should be tested. But really, down the road, we're going to need a lot more tests, and we may be testing people frequently over time. And in order to have that kind of capacity to get back to normal activity and being able to tell that a mild onset of symptoms is or is not COVID, we're going to have much more widespread, inexpensive, fast result testing really across our entire system. And there are some innovative approaches that are being tried, looking at different types of providers, perhaps, who can be the ones that order and administer tests. But these are all systems that we'll have to have in place in order to be in a future state where, again, we can be doing what we want to do and then having quick access to the test results.
Have you stay up there and answer a question from Taryn Mento from KPBS. The county has now provided the doubling time over the last few days. How do the figures inform you? What do the changes mean to you?
Well, a doubling time is another way of stating what a curve is doing in terms of bending over. So a very sharp upward curve has a very short doubling time, and a doubling time that's flat is increased. So we use that number as a shorthand way of talking about how the curve has been flattened, and that's what really the import or the meaning of the doubling time is.
All right, thank you, Dr. McDonald. And I have yet another one from iNewsSource. Jill, I'm hoping you can ask this. Is there a place on the county's website to see location breakdowns for people who died and not just people who have tested positive? Is the county releasing information on where these individuals died or where they resided? Assuming you're releasing where they resided, why not both?
Well, we are producing aggregated information about deaths, and Dr. Wooten has provided some of that. Upon request of the media, we actually do have a de-identified list of dates of death, age, gender, race, ethnicity, status of underlying medical conditions in general region of the county that the individual lived in. We don't necessarily think it's relevant where somebody died. Many of these individuals died in the hospital. So I think, and also it doesn't necessarily mean that's where they were exposed. Where they lived might not be where they were exposed. It goes back to answers we've given before that this geographic distribution of where individuals live in the county is information that is given because you've asked for it, and we certainly want to be able to give it in a way that doesn't identify people. And I think that if we give too much information about dates of death and specific locations, you can unfortunately deduce perhaps who these individuals are. And we're trying very hard to protect personal information because it's the right of these individuals and their families to keep that private.
I have another one for you. From Aaron Leathley from Politico. Can you describe what the task force that addresses cases near the border is doing as the county plans for reopening? What work is the county doing with Baja California to prepare for the impact cases from that state might have on San Diego County's reopening efforts?
Well, the task force is actually trying to do many different things. They're trying to describe the pattern of what is actually happening, working to be sure that the right assets are brought to bear to take care of individuals that may be disproportionately impacted. So we do know, for example, that those hospitals that I mentioned in the southern part of the county are seeing more cases and more ICU cases. So the good news is there's plenty of capacity within the system to be able to take care of a specific part of the county that is having a heavier burden. And we're actually utilizing protocols and procedures that are used every day in our emergency medical services. If there was a fire or disaster in one part of the county, we have long-standing procedures that allow individuals who have been impacted by that medically to be distributed across the county. So we're looking at how we can use those protocols to be sure that there is a fair distribution of cases across the county, particularly ones that need to be transferred by ambulance. We may, in fact, have to do facility transfers in order to make sure that there is, we're taking advantage of capacity throughout the county to care for individuals. That's just an example of what the task force is doing, but the task force really has quite a diverse membership from the Border Patrol, the cities, the county, emergency medical services, the Office of Emergency Services, the agencies that provide pre-hospital care in particular, and the hospitals themselves, to be able to, again, make sure that we have the right resources in the right places to be sure that we can care for all these individuals.
And I have a follow-up question from Lisa Halberstadt. What are hospitals being advised to do at this time when discharging a homeless individual who has not tested positive for COVID but may have a compromised immune system? Are hospitals being directed to refer individuals to the convention center? And if so, how has the county directed that to be coordinated?
Well, you're asking a question about something that's existed in the county for a long time. In fact, our discharge planners at our local hospitals are really amazing professionals who are able to bring together all the resources that need to be brought to bear to care for really anybody, regardless of their status. And homeless individuals have specific needs that our discharge planners and hospitals have dealt with for years. And they have excellent access to the different kinds of resources that are required. If it's a social service resource, behavioral health resource, housing resource, they are usually able to bring together what's needed to be able to support those individuals. And now we have more options available because of the hotels that we have access to for individuals with COVID or might need evaluation for COVID. So again, I would ask you to talk with some of our hospitals and some of the really amazing people that do this discharge planning so they can tell you what they do. And they could do it much better than I can.
That completes our texted and called-in questions for today, but before we conclude, I want to go out on a high note. we've mentioned how individuals and organizations throughout this region have come together and stepping up with incredible acts of kindness and charity over the last few weeks. And I want to highlight one more. There's probably no better champion of San Diego than our own Bill Walton. This weekend, I read about Bill's latest philanthropic effort to organize a virtual bike ride called the Bike for Humanity and help raise funds for organizations helping those affected by COVID-19. Bike for Humanity will be coming this weekend on April 25th, and you can find out more about it at events.com. Bill Walton has always been a team player, and we appreciate him helping Team San Diego. Finally, I want to give a shout out to one of our own. Yesterday, the San Diego Union Tribune began running a special section on individuals that have accomplished great things, and they were focusing on women in San Diego County. And among the phenomenal women they listed was our own county public health officer, Dr. Wilma Wooten. Dr. Wooten and others on our public health team have been working literally day and night and weekends to fight this virus and protect our region. And I want to thank her for her grace under pressure at this most difficult time. With that, we conclude today's media briefing. We'll be back here tomorrow at 2:30. And remember, stay in place, maintain space, and cover your face. Thank you very much. We'll see you tomorrow.